Hi everyone and welcome. This is week 3 of Patient Stories on MCNN. My name is Amy Smoot and I want to thank you for joining us. Just a quick little tidbit. I missed last week's episode because my entire household has been sick for 2 weeks. We still have some lingering effects, a little bit of a cough, so I apologize in advance if that interrupts anything that I'm doing today. But I just wanted to explain, if you were looking for last week's episode, it did not happen because we were ill. So anyway, this week, actually last week's show, I had planned to have Bryan, another one of the kids that I fight for, his mom, come on the show and talk to us a bit about what kind of problems Bryan has and how she thinks medical cannabis could help her son. However, this week, Bryan had to be hospitalized and spent a few days in the hospital. He is out now, but because of that, I wasn't able to interview his mom. So this is basically his story that I told to the Senate committee hearing. And then I did a little bit of research myself on mitochondrial disease, which is what Bryan has. So I'm just going to read a little bit about that. This episode probably will not be an hour long, so I just want to apologize in advance. But this is just a little snippet about Bryan, and then hopefully when he feels better, we can have his mom come on the show and talk to us a little bit more in depth of about Bryan. So anyway, Bryan is a 16-year-old boy. He lives right here in my part of Mississippi, northwest Mississippi. And he has mitochondrial disease, as I stated. And because of that mitochondrial disease, he also has seizures, very severe seizures. Just lost my earbuds, sorry, y'all. So, a little bit about him. Bryan had his first seizure at 13 months old, and he was not diagnosed with mitochondrial disease until he was 3.5 years old. He's failed 12 seizure pharmaceuticals, which means the seizure pharmaceuticals did not stop his seizures. So, as well as not stopping the seizures, they also caused some pretty horrific side effects. He was lethargic to the point that he couldn't sit up, excessive drooling. He sometimes had severe violent and aggressive behaviors. Those anti-seizure medicines actually caused him to have new types of seizures that he had never had before. And he also wouldn't sleep at all. We're talking days at a time. He would not sleep at night. He would not sleep during the day. He would not take naps. He did not sleep at all. Sorry, y'all. He also has severe food allergies, so that kind of impacts how they handle the mitochondrial disease a little bit. One of the most recommended treatments, as I was reading last night, for helping mitochondrial disease patients is the ketogenic diet. However, with Bryan's severe food allergies, they're not able to do the ketogenic diet for Bryan. She has tried CBD in the past for Bryan's seizures, and that did not give him any relief whatsoever from those seizures. So we are in the belief that Bryan is one of those patients. We see a lot of pediatric patients with seizures that CBD does not help, and it appears that Bryan is in that same boat, that CBD just does not help. His body needs the THC to stop the seizures. And as I kind of discuss a little bit more about mitochondrial disease, you'll realize that cannabis may help a lot of the other symptoms that are caused from mitochondrial disease. Now, mind you, these are general issues that arise from mitochondrial disease. And like I said, maybe when I get to talk to Bryan's mom, we'll get a little bit more personalized view of what Bryan suffers with from the mitochondrial disease. Because it's not just seizures for Bryan, he also has this debilitating disease. So if anybody is curious about what mitochondrial disease is, if you can remember back to science class when you were a kid and you were learning cell structures and the nucleus and everything about that, and we learned about the mitochondrial back then, mitochondria, but it had been so long for me I had almost forgotten. So I'm just going to go over a little bit of it. Mitochondrial disease occurs when structures which produce energy for a cell malfunction. One common factor is the mitochondria are unable to completely burn food and oxygen used to generate energy, which is essential for normal cell function. As you know, it would be imperative for your cells to function properly to keep everything working. I know that's one thing Bryan's mom has said in the past is because of the mitochondrial disease, his organs aren't functioning at 100% all of the time. So there are breakdowns from his body and his organs not being able to function appropriately because the actual parts of the cell aren't doing their job. Mitochondrial disease is very rare. It has all kinds of symptoms here. I'm just going to read a little bit off of Boston Children's Hospital is one of the places I looked up to get some information about it. And it says, because mitochondria are in every cell of the body, mitochondrial disorders can affect many different body systems and cause a wide variety of symptoms in different combinations. This can make them challenging to diagnose, which is probably, as I said earlier, he had his first seizure at 13 months and he was not diagnosed with mitochondrial disease till age 3.5. So there was probably that entire 2 years or so that they were just trying to figure out what was causing Bryan's seizures and get to the root of that. You can imagine how difficult that would be as a parent to not know what was going on with your child, and also if you don't know what's wrong with them, you don't know what to do to help them. So I feel like that needs to be said. The parts of the body that tend to be most affected are those that are in need of the most energy, such as the heart, the brain, your muscles, and your stomach. Symptoms can range from fatigue and exercise intolerance to weight loss, hearing loss, seizures, strokes, heart failure, diabetes, and kidney failure. A large majority, but not all children with mitochondrial disease disorders have a developmental delay, which means that they're not hitting their milestones as they should. Depending on the severity of the disorder, symptoms can appear at birth or they may not appear until adulthood. In some children, mitochondrial disease progresses quickly and can be severe. In others, it can be stable and well managed for many years. Sometimes symptoms begin suddenly, triggered by another illness. So another resource I was reading about symptoms, this kind of goes into a little bit more detail here, and it says symptoms can include muscle weakness, problems with coordination, loss of muscle tone, muscle quiver, nervous system dysfunction, which is that can cause seizures alone, just the nervous system dysfunction, fatigue, weak eye muscles, or rapid involuntary eye movements. Also common, as we said, was developmental delay, heart block, and this is seizures, heart block, seizures, and things like, and diabetes are caused because of the mitochondrial disease and the dysfunction in the cell. The cells aren't able to function correctly, so your body can't control its sugar or its insulin. It can't control the things that cause the seizures. Because your organs are impacted, it can cause the heart blocks, it can cause heart disease, it can cause strokes due to blood clots. So there's really a lot of symptoms. It seems like a very wide range of symptoms for mitochondrial disease. And of course, not everyone will have every symptom, but I know that Bryan specifically suffers from a lot of these. I know he has stomach issues. Like I said, he has seizures. I know that he's had some issues with behavioral issues due to the brain not functioning correctly because the cells themselves are not healthy. So the brain cannot function correctly. Also important to note is mitochondrial disease has no cure. There's nothing they can do to fix those mitochondria in the cells. So basically parents, or patients is a better word for it, patients treat the symptoms of the disease as they come, and they manage those with anything from different medications to, as I mentioned earlier, some exercise, physical therapy. It's basically symptom management, because you can't fix the cell, you can't fix the mitochondria in the cell to make it function correctly. So it's essentially a supportive therapy is all that you can really provide for patients suffering from mitochondrial disease. Also, depending on how many organs are affected, mitochondrial disease is very, very serious. So if your brain's not working correctly, your heart's not beating correctly, your lungs aren't functioning correctly, your kidneys aren't cleaning like they're supposed to, you can imagine the toll it would have on your body. So it's very serious, and oftentimes can be fatal because, as I said, there's no cure for it. There's no fix to fix the mitochondria in the cells that are causing the problems. One of the problems that arises is homeostasis, which is a property of cells, tissues, and organisms that allows maintenance and regulation of the stability and constancy needed to function properly. So when you have mitochondrial disease, your body is not able to achieve homeostasis. A few good examples of homeostasis are temperature regulation, insulin regulation, being able to, your body controlling the sugar itself without having to use insulin or those kind of things. So those are some good examples of homeostasis. And homeostasis is not able to be achieved when you have mitochondrial disease because the cells are not well. So toxic waste may accumulate in the body. If homeostasis is not restored, the imbalance may lead to disease and death. So that's kind of what I was talking about with the heart disease and things of that nature. It's after your heart works so hard for so long, there can be damage to your heart muscle itself, to your kidneys themselves, because they're not functioning correctly. So I haven't talked to Christine, Bryan's mom, about this, but I think this is where mitochondrial disease presents a lot of problems, because it can cause so many different symptoms. Bryan, as I said, has seizures. That's probably one of the most severe symptoms of mitochondrial disease that he has, but I know that it affects every area and aspect of his life. So you can imagine the wear and tear it takes on his caregivers, on him, his social settings, everything is affected because of this mitochondrial disease, and there's no cure for it. There's nothing we can do to fix it. So part of the reason that Christine, his mom, was behind Initiative 65 is because so many pediatric seizure patients are helped and their seizures relieved, sometimes 100%, when they add THC to their medication regimen. In reading all of the symptoms of mitochondrial disease, I'm learning that not only would cannabis, medical cannabis, help hopefully Bryan's seizures, but it would also help relieve a ton of these other symptoms that mitochondrial disease causes. And it may allow him to have a more normal functioning life. It would definitely help his stomach issues, his headaches if he has those. Seizures is the biggest relief because his seizures are getting more severe. They're lasting longer as he's getting older. It's another thing with mitochondrial disease is there's not many specialists that know a ton about mitochondrial disease. So, for instance, this week when Bryan was in the local children's hospital, they were not able to offer much support to Christine. They gave Bryan fluids. They, helped him bounce back and get rehydrated because he was dehydrated. But the root cause of what led them to the hospital and to the ER, she did not get much help or much relief with. So there's not many people in this area of the country anyway that specialize really in mitochondrial disease. So it leaves the parents of these children to do a lot of research themselves. And Christine is probably one of the most educated people that I have ever spoken with when it comes to cannabis in general. She came to this with a very big knowledge and information base just from research that she had done herself. And that is why she has sought and fought for cannabis to be legal, because she truly believes that it will greatly help her son not only relieve some of those symptoms and the seizures, but give him a little bit better of a quality of life. Because you can imagine with all of these symptoms going on all the time, his quality of life is not that great. He isn't able to get out and do a lot of things. And that's one thing we've really seen with Riley since she moved to Colorado and was able to get cannabis treatment, is how much a child can change with access to safe cannabis, pesticide-free, organic, safe cannabis, because that's one of the things that Bryan needs with all of his allergies. They need to know what goes into cannabis, what chemicals are used, they need to make sure that it's organic stuff that they're giving him, that they're not introducing anything that could possibly or potentially harm him more. And like I said, that's one thing we've seen with Riley, is how much of a difference it can make in a child's life. Riley went from in bed all the time, not able to ambulate on her own or move about on her own. Every time she needed to go somewhere, she relied on someone else to get her there, move her around, to now she is 3 years, 8 months seizure free, and she's getting a walker this month that's helping her be able to move. She's getting a communication device to help her to be able to communicate, because that's something she's never been able to do in her 9 years. So cannabis can alleviate so many of these children and other patient symptoms that it opens up a brand new quality of life. And for someone like Bryan, who's 16 years old and has suffered his entire life from symptoms of this mitochondrial disease, we owe it to them to try every treatment I said, and I firmly believe, doing no harm means stopping certain therapies when they have negative effects on the patients. So if we're not stopping those therapies and we're telling these parents continue on, it's only making their kids worse. All these pharmaceuticals are making these kids worse. They're making the kids sicker. They're making them have more seizures, different seizures. They are not working, period. We have to get these kids help. We have to get we have tons of adult patients as well that need this medication. This is not just kids, and in the coming weeks I have several adult patients that we will be going through. I just wanted to cover my kids first because they are the ones I've been working with for some of them over a year now. So I've told their stories to anybody that could listen and would listen, and I took it to the Senate committee hearings, and I told their stories to the Senate committee hearings. And I will continue to tell their stories to every single person that I come across, every chance that I get, because these kids deserve more. They deserve more. And anything I can do to ease the pain of their parents, to make their lives a little bit easier, I'm going to do. So that's why I went to the Capitol to talk to senators. It's not because I like senators. It's not because we're friends. I went as a mom to fight for these kids because somebody has to do something. I'm tired of these stories. I'm tired of telling these stories. I'm tired of saying we could have healthier kids if we would just legalize cannabis. But at the end of the day, that is the bottom line. We could have parents, children, patients of all ages, from grandmas to children, benefit from this life-saving, life-altering medication. It is legal in 36, 37 other states in our country. There is absolutely no reason to keep this from anyone who needs it any longer. I'm done. I'm going to keep fighting. I ask that you keep fighting. We can't give up. Bryan needs us. Miles needs us. I have a whole entire list of kids that need us to keep fighting. And we're going to do that. You and I, we're going to do that. We're going to keep bugging these lawmakers because it's the least we can do. Time is of the essence. And every day that slips by is another day that Bryan and Miles have unrelenting seizures, non-stop seizures. So if their parents can get up and face every day of their child seizing, then I can get up every single day and fight for their kids to have safe medical cannabis. I hope that you'll join me in doing this. I really do. This is why we fight. This is who we fight for. Cannabis is medication, and we need our legislators to legalize their medication. Period. Point blank. These kids need this. That's about all I have for today. I thank you, like I said, for joining me for the third installment of Patient Stories. I'm sorry about this microphone issue. I hope to have it fixed at some point in the near future. If you have any questions, reach out to me on Facebook, and hopefully this week we'll have some more videos from Chad and Teresa, and I will be back next week with another patient story. Bye. Thank you.